day that the Lord has made, and we are going to rejoice and be glad in it because we have a risen Savior that was wounded for our transgressions. He was bruised for our iniquities, and the chastisement of our peace was upon him. And with every stripe that he took, we are healed. Today, I'm going over a topic that was requested. I won't say by whom. And that topic is on alopecia. So what is alopecia? Alopecia is a lack or loss of hair from areas of the body where hair is usually found. Most people lose hair on their scalp or beard area, but hair loss can occur anywhere on your body. So what causes alopecia? People typically lose 50 to 100 hairs a day, like that's normal. This usually isn't noticeable because new hair is growing in the same area. Hair loss occurs when new hair doesn't replace the hair that has fallen out. Hair loss is typically related to one or more of the following factors: a family history, which makes it hereditary, hormone changes, and medical conditions. So there's a variety of conditions that can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is immune system related and causes patchy hair loss, scalp infections such as ringworm, and a hair pulling disorder called trichotillomania. I dare any of you to say that quickly. Other causes, medications and supplements. So I talked the other day about taking your vitamins. When your when your mineral levels are low, that can also contribute to you having hair loss. So hair loss can be a side effect of certain drugs, such as those used for cancer, so like chemotherapy, arthritis, depression, heart problems, gout, and high blood pressure. Radiation therapy to the head. A very stressful event. Hairstyles and treatments. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil treatments and permanence also can cause hair to fall out. If scarring occurs, hair loss could be permanent. So what are the signs and symptoms? Hair loss can appear again in many different areas depending on what's causing it. It can come on suddenly or gradually and affect just your scalp or your whole body. So you have gradual thinning on the top of the head, and here's a picture of that. This is the most common type of hair loss, affecting people as they age. In men, hair often begins to recede at the hairline on their forehead. Women typically have a broadening of the part of their hair. An increasingly common hair loss pattern in older women is the receding hairline, called a frontal fibrosing alopecia. And this is just photos of different areas that people start losing hair. This is a picture of the traction alopecia. So some sign of symptoms continue. You have circular or patchy bald spots, sudden loosening of hair. So like a physical or emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or brushing hair, or even after gentle tugging. This type of hair loss usually causes overall hair thinning, but it's usually temporary. Then you have full body hair loss. Some conditions and medical treatments, such as chemotherapy for cancer, can result in loss of hair all over the person's body. Then you have patches of scaling that spread over the scalp. This is a sign of ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. So what are the risk factors? A number of factors can increase your risk of hair loss, including, again, family history or balding of your mother or father's side, age, significant weight loss, certain medical conditions such as diabetes and lupus, stress, and poor nutrition. So a dermatologist is who really diagnoses if you have alopecia. Your regular doctor can look and suspect and tell you they are also trained, but a dermatologist is going to be more detailed in making sure of the diagnosis. So a board certified dermatologist, by looking carefully at the areas with your hair loss and nails as well, because most people, when they have hair loss, you can look and their nails also, they're having some kind of. To get a closer look, your dermatologist may use a tool called a dermatoscope. And this tool magnifies, giving the dermatologist a better view of what's happening. Dermatologists will also ask you about your health and what diseases close blood relatives have. Sometimes dermatologists would need to remove a few hairs or perform a biopsy of the bald area. You may also need blood tests to look for thyroid disease and check if you have healthy levels of iron and vitamins. Once your dermatologist has done all the necessary, gathered all the necessary information, you'll find out if you have alopecia. So treatment options that are available. From the medical standpoint, there's corticosteroids. Now, this one is very common, Rogaine, just that you may end up growing hair where you don't want hair grown in unusual spots. And I've been told that sometimes when you stop the Rogaine, then you end up losing the hair again. I have no facts on that, but I've been told. Then you have phototherapy that is sometimes done, and they do platelet-rich plasma, where your healthcare provider removes blood from your body, processes it, and then injects it into your scalp to stimulate hair growth. Some side effects of this, however, may include scalp pain and irritation, dizziness, nausea, and some vomiting may occur, not necessarily occur, but can occur. Then they do topical immunotherapy, where your healthcare provider rubs an allergen into your skin to create an allergic reaction, which is called contact dermatitis, which produces hair growth. Some side effects, however, may include some scalp irritation, and you may have swollen lymph nodes, eczema, and skin discoloration. Everything that you have to warn you of what the possible side effects are, it doesn't necessarily mean that you will get them. Please remember that. Some people may not want treatment, right? And treatment may not work for them, leading them to options for hiding their hair loss. These may include styling products like gels, mousses, powders, and sprays. They have powders that can be the color of your hair that the person sprays it on their head and you really don't know that it's not hair. And these help to keep hair in place the amount that they have. Some people do wigs, hair pieces, or scalp prosthesis. And this is not only for women, but there's a lot of men actually that are doing this. It's more common now than you think. Shaving, some people instead of covering up their head decide to just shave the whole thing off and just go bald. And a lot of them I've seen, they look beautiful. Microblading for eyebrows, because there's a lot of people start losing their eyebrows as well. And you want to make sure that you see your dermatologist to discuss what the options are for that. And then there's hair products that people are using, and different vitamins. Keratin is one of them. Here are some of the vitamins that are on the market now. So you have collagen, liquid iron, because a lot of people, their iron levels are low when they have a lot of hair loss. D3 levels can be low also. Biotin. They have hair, skin, and nail vitamin. There's a company called Nutrafol that makes vitamins for hair loss for men as well as women. They're different. The women usually have the green circle and the men has the blue. And then there's one called Vivisco that is also used at times. And these are just some, not all that are used. So let's talk about diet and healthy hair. A healthy diet can help your hair stay strong and shiny. What you eat can also keep you from losing your hair. If you're not getting certain nutrients from food, you might see the effects of your hair. Essential fatty acids, like your essential omega-3, play a key role in the health of your skin, hair, and nails. You should eat some of these foods, which are rich in omega-3, every day if possible. Salmon, tuna, mackerel, and other fatty fish, unless it is contraindicated for any medical reasons, okay? Flaxseed oil is also good for you. Flax seeds, chia seeds, canola oil, walnuts is also good for you. And walnuts is also good for your brain. Soybeans, tofu, and cruciferous. Vegetables like broccoli, cauliflower, Brussels sprouts. I remember my mom forced me to eat this as a child, and I hated them, but I had to eat them because mommy said so. Your B6, your B12s, your folic acids are also important in your hair. Vegetarians and vegans often don't get enough of them. Foods in B6 may include bananas, your potatoes, both white and sweet, and spinach. Major sources of your B12 include like your meat, your poultry, your fish, and dairy products. Protein is also critical in keeping your hair healthy, but many people don't get enough. Lean meats like fish and chicken, eggs, and soy products, again, are good products, are good sources of this. So prevention. Most baldness is caused by genetics. This type of hair loss is not preventable. These tips may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler and avoid tugging when brushing and combing your hair. Even when you go to the salons, you want to make sure that they're not being vigorous, like being rough and pulling your hair and all that and tugging on it. You go to the hairdresser, you want to make sure that you do a good deep conditioner and treatment for your hair. A wide tooth comb might help prevent pulling out your hair. Hair products and treatments that contain harsh chemicals, you want to make sure that you try to avoid those as much as possible. These include some chemical straighteners and permanent waves. Try to find gentle shampoos and conditioners without silicones and parabens. Take your vitamins. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, and permanents. Again, limit the tension on your hair from styles that use rubber bands, barrettes, and braids. Ask your doctor about medications and supplements you take that might cause your hair loss. Protect your hair from sunlight and use sources of ultraviolet light. Stop smoking if you do smoke. Some studies show an association between smoking and baldness, especially in men. If you're being treated with chemotherapy, ask your doctor about cooling cap. This cap can reduce your risk of losing hair during chemotherapy. And if you are on chemotherapy, remember, if you don't know, your doctors can actually write prescriptions, and your prescription cover you getting a wig at certain places for free. An overview. Hair loss, alopecia, can affect just your scalp or your entire body, and it can be temporary or permanent. It can result in be a result of hereditary, hormonal changes, medical conditions, or normal part of aging. Anyone can lose hair on their head, but it's more common in men. Baldness typically refers to excessive hair loss. Okay, so remember, again, it can be hereditary, but not necessarily. Okay, others may choose to cover up their hairstyles with makeup, hats, scarves, wigs, weaves, whatever you choose, whatever makes you comfortable. Go for it and celebrate yourself. Treatments may include, again, medication, hair transplant, and more, because they do hair transplant, where some doctors may take the hair from the back of the head and implant it in the front. Okay, eat a well-balanced diet. Hair growth is a vitamin and mineral dependent process. Although not specifically related to alopecia, people who follow fad diets often have problems with hair loss. The Mediterranean diet includes fruits, vegetables, and protein that may help strengthen your hair and minimize loss. Consider taking vitamin D supplements, because a lot of us do have low vitamin D, especially in the African-American community, because we think we don't have that because of the color of our skin. That's not true. That's false. So please make sure that you're checking those levels as well. I want to give special acknowledgement to the American Academy of Dermatology, Cleveland Clinic, National Institute of Health, the Mayo Clinic, and WebMed for the information that I provided you today. I hope this was helpful, especially with the person that asked. God bless. Enjoy the rest of the Sunday, and remember, our Savior is risen. God bless.